Good afternoon, everyone. Thank you for joining us today for this webinar on the role of occupational health in supporting employers and employees. We're delighted to be joined by Ron Cuthbert and Joe Watersmith of Agile Occupational Health, who will be presenting on a number of the areas for discussion today. Also on the call with you, myself, Antonio Fletcher, Head of Employment at Whitehead Moncton, and Veronica Fox, who is our Senior HR Consultant at Eclipse HR. Running through the points of discussion today, we'll be looking at what is occupational health, what's new in occupational health, both the role of HR and OH practitioners, instructing occupational health specialists, how to interpret an occupational health report, some legal considerations, and then we'll have some time for questions at the end. We've had a few submitted in advance, but if you do want to ask any questions as we go through, then please do put them in the Q&A, and we'll pick those up at the end. Hopefully, we will have a bit of time for questions. So, without further ado, I think Veronica, are you up first?
I am. Yes, thank you very much, Antonio. I am. So moving on to what is occupational health, Ron Cuthbert, as Antonio said, Clinical Director and with us today, kindly provided the following details. Occupational health is a sector of healthcare within the public health arena that promotes and maintains the physical and mental health of the working population across all occupations and sector. That's from the World Health Organization 2022. The science and practice of occupational health involves several disciplines, such as occupational medicine, nursing, ergonomics, psychology, and other medical professionals. So from that perspective, we'll move on now to the development in occupational health provision. But I felt it was really helpful, and Ron, Joe, and Antonio and I really just to set the scene of what that actually really means in terms of occupational health from that perspective. In 2022, in terms of developments and occupational health provisions, 2022 to 2023, more than 1.8 million workers reported work-related illness, with nearly 50% being attributed to work-related stress, depression or anxiety. Now, that may not come as a surprise to many of you. We've seen from the attendees today, many HR professionals are with us. The government statistics have shown that only 28% of employers provide occupational health services to employees, and large employers are nearly 3 times more likely to do so than small to medium-sized enterprises, SMEs. But the evidence review of Waddell and Burton has confirmed that being in work is generally better for health and well-being than being out of work. And we've seen the change in demographic that's really come upon us in the workplace and will do in the decades to come. More females in their 50s working than ever before. So it's certainly something for us to look at, how we journey in terms of the development and we work with our workforce as they develop too. So in terms of the occupational health proposals, following the end of its Better Working consultation in November 2023, the government's launched an occupational health task force to consult and set minimum levels of occupational health required to reduce workplace illnesses and job losses. And the key proposals, as you can see, are introducing a voluntary minimum framework for the provision of occupational health services, exploring options for a group purchasing framework for small to medium-sized enterprises. I think that's going to be a really interesting one for all of us. The most SMEs are actually based in Kent than any other county in the country. So that's certainly one from Kent-based that we'll all be keeping a close eye on. And also developing a long-term occupational health workplace to build a multidisciplinary workforce. The aim of the initiative is to tackle workplace sickness by helping people to start and stay in work, with the wider goal of boosting the economy. And the framework is likely to focus on both the physical and the mental health in the workplace, which will task us as employers with the challenges of considering all types of sicknesses, including those that on appearance may not always be visible, and we understand that. There is also a focus on the older workforce, and that's something that I've touched upon earlier, who, although may not want to leave employment, may require flexibility from employers in providing training, recruitment, and flexible working processes. Now, whilst we're not talking about the changes to the flexible working legislation that's come through this year, again, that's something that you can see how this is all approaching a joined up approach to what that means for us in the coming years and decades ahead. Moving on to Occupational Health Innovation Fund. The Occupational Health Innovation Fund has been set up to provide funding to develop new occupational health models, with a particular focus on improving the capacity of occupational health providers and their services. Whilst businesses of all sizes are impacted by both workplace sickness and the forthcoming framework, again, small to medium-sized businesses, SME, are likely to benefit greatly from the new framework because of the increased access to occupational health services and available funding. In terms of that, it will be interesting as we meet our clients and our connections, and no doubt Joe and Ron as well, it will be most interested to hear how that actually forms in practice in the coming months. So the voluntary and free occupational health framework for employers is expected to be published in summer 2024. So it's coming out very soon. A compulsory framework hasn't been ruled out. That's one to watch. And as an employer or HR professional, I would suggest it would be prudent to review the framework once implemented and consider any new guidance that may benefit your employees. And we're always on hand to have a discussion around that, because Antonia and I and our colleagues within the employment team at Whitehead as well, we journey once these guidances come through. So in terms of the impact on businesses, and that's moving on to the next element, the impact of the framework and the guidance is likely to be seen over the coming months. There's a lot happening in the coming months, as we all know. Following any implementation, it will be interesting to see how responsive and accurate it is in practice. So that will be yourselves and us seeing how that really works and whether there is a noticeable reduction in work-related sickness going forwards. So what might you consider doing in the meantime as an employer? We hear ourselves ask, ensure your sickness absence policy and procedures are up to date, so that sick leave and any reasonable adjustments required to assist with employees returning to work can be effectively managed. Consider researching what occupational health services are available in your area, the services they offer and their costs, as well as reviewing the value provided by any previously retained OH advisors. And whilst costs are key, you will no doubt want to consider the responsiveness and the quality of the advice provided by occupational health providers. As you can see, we have Agile Occupational Health with us today, who I'm sure would welcome follow-up contact with you to discuss that in more detail. Many organisations take a reactive approach to occupational health, but I certainly can say as a HR professional, I've seen the benefits of having a joined up approach in place with an occupational health provider. As an employer relations manager in a previous organisation, I discussed with occupational health professionals various cases on a fairly regular basis, with the aim of either facilitating a reduction in sickness absence rates and/or supporting our employees in the short, medium to long term, very much depending upon the nature of their medical situation. My understanding of the aim of the task force and framework is to build a healthier and happier workforce and building access to subsidised occupational health services that small businesses can make use of. Sounds good. It sounds like it's going in the right direction, in a positive direction. Let's see once again how that really pans out in terms of practicalities. Before I move on to the role of HR and occupational health practitioners, you will no doubt have read about or heard on the news proposed reforms to the Fit Note, which has come about following last year's autumn statement, which confirmed the government's intentions to carry out the Back to Work plan for welfare reforms. Call for evidence currently remains open to the summer. There's a lot going on in this summer, so it's very soon, which is likely to be followed by full consultation on specific policy proposals later in the year. I'm now going to move on to the role of occupational health, of human resources and occupational health practitioners. Occupational health and HR practitioners are the two professional groups that often people see as most concerned with the health and well-being of people at work. I'd actually argue that managers equally have a proactive and a very keen and genuine interest as well. As such, the strength of the working relationship between an OH practitioner, human resources, but also in conjunction with the line manager is critical. And it's time to evaluate whether a fuller appreciation of each profession's role by the other could encourage stronger collaboration to achieve a mutual aim of a more strategic and preventative approach to employee health and well-being. And Ron and Agile HR and Joe will explore that a little bit during this webinar. But from a HR perspective, we also need to consider how we benefit more from a valuable specialist knowledge that occupational health offers. The CIPD research consistently shows that employers and HR professionals view occupational health services as a valuable resource to manage employee health at work, with access to occupational health services identified as one of the most common and effective interventions for managing sickness absence. So, for example, the 2023 CIPD Health and Wellbeing at Work report, supported by Simply Health, finds occupational health involvement is the fourth main method for managing long-term absence. That's 73% of employers. And offering OH assessments is the top way organisations support people with long COVID, 72%. We had an interesting discussion, the four of us, around long COVID, but that's not a point that I'll discuss. There are others on the webinar today that are much better qualified to discuss that, if that might be of interest in the questions that you have. The main view of occupational health, on the other hand, is as a reactive referral service for long-term sickness absence, rather than a specialist and valuable resource for both strategic and preventative approaches to employee health. Again, 2020 CIPD research found the majority, 68%, agreed that their occupational health services are primarily used for referral in case of a long-term sickness. Just 1 in 3 employers use occupational health specialists to prevent, mitigate risks to mental health or to develop a mental health policy. And just 29% agree that HR and occupational health work closely at a strategic level to help prevent ill health. Now, I'm not going to put my partners on the call today on the spot to say, I wonder how that's changed in the last 4 years. We've had a lot going on in the last 4 years, but that would be quite interesting to see if there has been a journey post-pandemic. Nonetheless, these findings suggest that many employers and HR professionals tend to view occupational health predominantly as a referral service to deal with complex cases of sickness absence when ill health issues have already escalated. And there could be clear benefits from involving occupational health in health-related issues at an earlier stage where appropriate. And that could look at perhaps looking at main health risks, identifying those, ill health prevention, working together to develop strategy and policy for workplace health interventions, or effective, reasonable adjustments, to name but a few. So in relation to the evolving world of work, the policy paper notes that the rapidly evolving world of work presents new risks. I think there are risks wherever we go in that sense. New risks, challenges, and issues for workers' health that occupational health and HR practitioners may struggle to keep up with. With this in mind, it makes a number of recommendations for HR and occupational health practitioners, which I would suggest you may want to research further and consider, or feel free to give me a call. I would always welcome an opportunity to discuss this further. I think it's always really helpful for us to see what the changing landscape unfolds. But for now, I'll be handing over to Ron Cuthbert, Clinical Director of Agile Occupational Health, who will be exploring instructing occupational health specialists and how to interpret an occupational health report. Thank you.
Thank you, Veronica. So with regards to the kind of role of occupational health and the OH professional in the OH provision in the UK, I think it'd be useful just to run through what the kind of OH professional role is. So the OH professional role, we have a dual responsibility to the employer and the employee. We're independent, impartial, and provide advice on the individual's fitness to work. OH professionals must work within the parameters of the GMC and the NMC, along with current guidelines. Occupational health is an advisory service, therefore we don't diagnose or treat individuals. Therefore, for most case management function, this can be done remotely via video consultation or phone consultation. OH services in the UK are not provided free of charge via the NHS, so therefore the employer must access these via a private provider. Interestingly, I read a piece of research a few weeks ago that said that less than half of the working population have access to occupational health advice and support, with around 23% of SMEs only have OH provision. So that's a big chunk of people that are not having access to it. With regards to other services OH provide, along with the case absence management, they also provide pre-employment questionnaires, new starter questionnaires, which are questionnaires that are a bit more in depth for things such as healthcare workers, safety critical workers, working at heights, working night workers, statutory medicals to ensure that you are compliant with regulations. Your occupational health team should always offer you health surveillance, so audios, respiratory, skin surveillance, hand-arm vibration surveillance as well. Employers have a statutory duty under health and safety law to provide that to their employees should they be exposed to any of that. There's also other specialist medicals such as asbestos, iron radiation. Other advice you may access from occupational health is ill health retirement, vaccinations and immunisations, any wellbeing strategies within your organisation, and supporting with risk assessments regarding stress risk assessments, pregnancy risk assessments, and fitness to fly advice. So this brings me on to when to commission and what to include in the OH referral. Now, as you can imagine, we see a huge gamut of occupational health referrals. I think if there's one thing that you take away from today, it is early intervention. That's the most important thing that I can kind of illustrate today. So point one, early intervention. Referrals as early as possible you can even refer before someone goes off absent. So this would kind of tag into the presenteeism. Referring someone early before they go off absent may be able to provide support in the workplace to prevent their absence. But if someone is absent, you really shouldn't be going much longer than 5 days before you're starting to discuss with the employee a referral into occupational health. And that should be coming from a kind of supportive angle. We often get referrals where individuals have been off for months on end, and before they're referred. I had one not that long ago. Someone had been off for 5 months. They were referred. When the referral came through, it said they were due to return to work on Monday. Referring so late in the day, you will not have the advice for the individual returning back into work. So I know that sometimes things get down the road and you think, oh, we need to refer them to OH, but you should really put that block much earlier in the process. And this came to fruition in March 2024, when an employment tribunal, it was Wright Turner versus the London Borough of Hammersmith and Fulham. When in the judgment, this is one of the biggest payouts in UK history, but within the judgment, the judge actually said in point 182, we find that there was an inexplicable failure to refer the claimant to OH for the entire period of 3 months. And actually, you can see the cost that was attached to that if you actually read the judgment. So the judge, saying 3 months is far too long. So these things are examined should something end up in tribunal. So please, early intervention. So the next thing you should include in a referral is please provide a job description. The job descriptions are great because they tell us kind of what the main activities and tasks are doing. But what I would suggest you do is you be as specific as possible. So some job titles are obvious, but some finer details can massively vary between companies or businesses. So, for instance, the obvious example would be a nurse. So a nurse can work in the community, they can work in theatres, they can work on the ward, they can work in occupational health. but they can work in day surgery, they can work in intensive care. So although the job title is the same, their actual tasks on a day-to-day basis are very different. The demands of the job are very different. If they're a locum, if they're covering maternity leave or something like that. So be as specific as possible with that. Don't just attach the job description and say, well, that's that done, tick. Give more information if you can. Some job descriptions pre-COVID may say that their working location is in the office 5 days a week, but in actual fact, for the last 4 years, they may have been doing hybrid working. So put that in the referral that they do hybrid working now. It's really useful to the clinician that will be seeing them. Point 3, give as much background as possible. So think about, when did the issue start? Is it a performance issue that started and then you've had a discussion with that, and then that's then flagged up there's been a health issue? Has this issue happened before? Have they been referred to occupational health in the past for the same issue? Has the issue changed? Will the advice change? Has the medical condition changed? So I need an update on my OH advice. So start thinking around things like that. Is it suspected to be work related, or is it completely personal? Quite often, a lot of these things are multifaceted. So to actually extrapolate it out is very difficult, but think about that. Have you attached their sickness record? Has anything changed within your organisation that could be impacting on the individual? So, for example, have you had an office location move, so the individual's commute is further, so there's resistance to that? Has there been departmental changes? Has the individual been a really good performer, has been promoted, and now they're starting to struggle? So, is there a kind of training and support and mentoring element potentially to this? So start to kind of think of the kind of wider relevant background when you're submitting. There may be none of that above applicable, so but it's worth thinking about. The reason for this is because the more we know before the consultation, the more time we can spend exploring possible ways forward. Okay. Point 4, give any existing adjustments or possible adjustments that you've already put in place. So if you've done the great work and you've met with the employee and you've put in some sort of adjustment already, let us know that, because and also let us know, is that adjustment working? If you put adjustment in place and it's not working, then say we put this in place but it doesn't seem to be working and this is the difficulties we're experiencing. That's also really helpful. So let us know if you put anything in place and if it's working or not. And in my experience, it is best when HR and occupational health work very closely together to support employees back into the workplaces. It's really good if we kind of got the same view on trying to get employees back into workplaces and supporting them in the right way. So you may need to look at, does your policies underpin this? Point 5, ask specific questions and ask the right question. So we see all sorts of questions that have been added into referrals. So on our referral, what we've done is we've gave 8 or 9 questions that should pretty much cover everything you need to know, and that are appropriate. Don't just tick all the questions that are on the referral without actually considering, do I need to know this? Do I want to know this? Is this going to move anything forward? So don't ask us about if ill health retirement is applicable if the individual is off with a broken leg. Because it's kind of then becomes a bit clear that you haven't really thought about the referral. It's just a tick box process because they're off, we better refer them. So really think about what you're asking. It's unlikely in a OH referral or report that you will need to know the specific types of medication your employee is on. So we have had questions like this where the employers ask, what medication are they on? And they expect us to break it down to them. Unless it's a safety critical role, it's not really something that you would really need to be considering. OH will consider that during the consultation, and the report would say something along the lines of X is receiving appropriate medical treatment for their underlying medical condition, or X is receiving appropriate medical treatment for their depression, if you know the condition, in the form of medication and counselling. So we don't need to kind of get into the nitty gritty. You just need to kind of know that 1, they've got the medical condition, and 2, they are getting the appropriate treatment. And then question 6, check that it's definitely a medical issue and not a management one. Medicalizing a management issue will not make your life easier. Quite often it complicates matters. I know that it can sometimes be very difficult to distinguish whether it is a management issue or whether it is a health issue. But if it is a pure management issue, please, and there's no underlying health condition, occupational health is going to add very little value to that. So the role of OH is to consider whether there's any medical reason why the employee cannot fulfill their contractual duties, e.g. if the employee is, say, arriving late at work, but there's no evidence of a medical condition, it is unlikely that we will be able to offer you any useful advice, except for we will say there's no medical reason for their lateness. Please manage under your local policies and procedures. That may be what you're looking for, but that's pretty much all we would be able to say on that front. Next slide, please. So just continuing on from that, one of the big things we get in occupational health is at the bottom of the referral, there is a little box to say that you have discussed the referral with the employee before submitting. That actually means you have discussed it with them, not that you filled it out and then that you've sent it to them afterwards or once you've submitted it. And this can sometimes cause real problems in the consultation for the clinician because the employee is either not aware of why they've been referred, they feel that OH is kind of a punishment or something like that, or along that lines. So it is really good practice to discuss this with the employee and say, look, I would like to refer you to occupational health. I would like to know what we can do to support you either in the workplace or getting back to the workplace. And this is what I'm going to put in the referral to OH, and I will obviously share it with you. So at the start of the consultation, we do ask the employees, have you had sight of the referral? If they say no, we read the referral to them verbatim. So don't think that you can put something in there and, it's for us to address with them. It's really for the management or the HR team to address that with them, in advance. So be open with the employee while you're referring them to OH. The employee knowing about the referral in advance reduces the risk of hostility during the OH consultation. It also helps reduce your DNA rates. So if the employee doesn't know why they're being referred to OH, the likelihood is they just might not turn up. And an OH provider will charge you for a DNA rate. Therefore, there's no value in paying for a consultation that doesn't take place. Make the employee feel part of the process rather than it's something that's being done to them. And because this also helps with consent when we're consenting them for the report to be released back to the employer, or even if we're consenting them for them to go through with the consultation. So again, within occupational health, we've got to work within the parameters of consent. And then the next point kind of feeds back to one of the earlier points. Understand how long it will take to get the report back from the OH specialist. So if someone's been off for 5 months, there's no point referring them on the Thursday before they're due to return to work on the Monday. Standard KPIs for the OH world are usually from receiving the referral, a 5-day KPI for the appointment taking place, and then post the consultation, a 2-day KPI to get the report written, consented, and back to the employer. So with all that running smoothly, you're looking at potentially 7 days to get the advice back. A lot of OH companies will be able to do it quicker than that, but that is roughly what you potentially might be looking at. So that's useful to know. And the final point there is kind of know your process once you receive the OH report back. So when you get the report back, what I always kind of say to individuals is use the report to facilitate a conversation with the employee. So it's not you as the manager or use the HR professional that is kind of saying, well, we got the report back and this is what we're doing. Just kind of discuss it with them. So what you need to consider is you're not legally obligated to take the advice, but you should at least consider the advice. If you dismiss the advice, one thing I would say is please document and give reasons why you've dismissed the occupational health advice or any of the reasonable adjustments, as you may need it in the future should anything end up in tribunal. So please give it some consideration. You also need to consider what is kind of reasonably practical along with what is operationally possible. So if you've got a team of 2, the kind of adjustments that you may be able to make might be much more reduced than, say, if you've got a team of 100, because that workload can be spread with throughout the whole department or team. So that's some things there. If Occupational Health recommend a stress risk assessment, we can provide you with a stress risk assessment and kind of guide you through it. But it's for the manager to complete with the employee. And again, use that as a kind of, use the stress risk assessment to hang the conversations off of regarding if it's workplace stress. You know, the first question is often, is your workload manageable? Yes, no. And then you can kind of go from there. So the stress risk assessment is also very useful for guiding conversations. Next slide, please. So this is our referral form here. So what to kind of include, and it's obviously the job role is really important, summary of the main duties, working pattern is also really useful. Is it Monday to Friday, 9 to 5? But in reality, are they working 8 till 9 or 9 till 6 or whatever it may be? Working location, so if they've got hybrid working, that's useful. If their role is a role where they can only work on site, that's also useful to know. So I've seen or I've spoke to clients before where they may say, we had an immunisation nurse and they've been told to work from home. Well, clearly they can't. They need to be present to give the immunisation. So working location is also useful. And then current absence status. Are they currently at work? Are they currently off work? Are they at work but they're working from home on a reduced basis? All that information is really useful, and this is your opportunity within this referral form to put that there. So reason for referral is include the health problems, include any performance issues, because the performance issues could be because of the health or could be impacting on each other. It's usually a two-way process. Attendance record, and any management processes that have been undertaken. So if the individual is on a performance improvement plan, it's good to also include that. So again, we've got that information and we can kind of explore that with them as well, and give you advice on that subject as well. We won't ever advise that a performance improvement plan or anything like that is paused, because that's not for us to comment on really. But we will kind of refer back to how it's impacting on their health potentially. Okay, next slide, please. Again, to continue the referral. So here is the section where a lot of the management information is put down. So I suppose the referral, you quite often hear as well sometimes that OH reports are too employee-centric, and quite often that will be the case when there is lack of information from the management or employer side. So where it says on there, background and any relevant information, that is your opportunity to put across the business's side of the issues. Okay. So background, any organizational changes that may have impacted on the individual. Are there any workplace adjustments that are already in place? We've already covered all this. Questions, what do you want answered? Consider what you're looking to achieve. I would always say what we look to achieve is move the case forward in some way. So whether that's move them forward and they get back into work, move it forwards where they attend a disciplinary meeting, move it forwards where it's an ill health retirement issue, so on and so forth. I had a case recently where the whole referral came through on a triage point. It looked pretty straightforward. Went into the consultation. The referral hadn't been discussed with the employee. The employee was quite hostile and it was kind of like, I'm not sure why I'm even here, because we've already started the employment tribunal process. It was already at stage 1 of the employment tribunal. So there's very little that as OH we can add to that, because that is, the ship is quite far sailed on that. I think all we were able to offer was mediation, but ACAS had already offered that before they started the kind of whole process. So really look at timing of your referral. Next slide, please. So understanding the report. So this is query anything you're not sure about. If the report is unclear, then go back to the clinical person and just suggest to them that, can I discuss the report? I'm not quite sure what it's telling me. If you're not sure what the next steps are, again, ask for that. But I would say it's good practice. Once you receive the report, read it, consider it, meet with the employee to discuss, make a plan, what can be implemented, what cannot be implemented, give reasons why it can't be implemented, and then document all that in their kind of HR file. Use the OH report and the social assessment to hang your conversations off to make the discussions easier. And then understanding your obligations as the employer, and seek guidance from HR or senior HR business partners with regards to what the company can do from adjustments and / recommendations. Next slide, please. So like we said, we must work within the parameters of consent. So sometimes reports may seem vague. And the reason for that will be because the individual may say, I don't want my employer to know my underlying condition. I don't want to declare it to them. So we are now in the position of saying, well, it's really useful for your employer to know because it helps them manage the situation. But equally, we've got to balance them withdrawing consent and you getting no report at all. So if you get a report, it says X has an underlying medical condition, it's probably because they don't want to disclose their condition. Okay. So that's kind of that. Perception and perceives is often used within OH reports, especially where there's around a management issue. So we're not there to validate what the employee is saying are the management issues. We're not there to lay blame on anyone. But what we do find quite useful is to let the employer know that X perceives these issues, because I think that can then help potentially iron out some of the issues. So we're only saying that they perceive them, or this is their perception of the situation. And quite often that can help move things forward as well. Reasonable adjustments are for you to consider. Regarding the Equality Act, it's a legal decision. So what we will say is it's likely or unlikely to apply in the case, but this is ultimately a decision for the courts. So you as an employer need to know what your duties are around the Equality Act, which Antonio will cover in later slides. Next slide, please. So the benefits of utilising OH, compliance with legal responsibilities, reduce staff turnover, increase productivity, reduces harm to reputational risk, protect and promoting employees' health, reducing related ill health, reducing absenteeism and presenteeism, improves the culture of the organisation, and helps fulfil corporate and social responsibilities. Next slide, please. Coming on to presenteeism, these figures are from 2018. As you can see, absenteeism is often what we focus on. However, presenteeism is just as costly. So presenteeism is mainly due to kind of mental health issues normally, and this could be because having a detrimental effect on your organisation in terms of cost, and is often a hidden iceberg within organisations. The health problem has not improved since 2018. The cost in 2023 was estimated at 48 billion, so it's gone up. The key things to note here are dealing with presenteeism early can often help with additional costs like staff turnover, because individuals quite often will leave the organisation. And so that's just a kind of illustration of, even if someone isn't off work and they're in work and you know they're struggling, please refer them in. Next slide, please. So this is just a summary. This is just the takeaway point. So like I said earlier, if there's anything you leave with today, it is early intervention, early referral. The referral is your opportunity to put across the manager or the organisation's concerns. Please give as much detail as possible. Discuss the referral with the employee before submitting. Makes the consultation much easier, and you will get a better outcome. Do not medicalise a management issue, and reasonable adjustments are for your consideration. Okay. Now, thank you for that. I'd like to hand over to Antonio now.
Thank you very much, Ron. So moving on to some of the legal considerations, I've noticed we do have a question that's been put into the Q&A, which we'll come to later as well. But please do continue to put those in if anything arises that you would like some further clarification on. So looking at the legal perspective, a helpful starting point in terms of sort of basic law that all employers need to be mindful of and need to be complying with is the Health and Safety at Work Act 1974. And amongst those general duties within the Health and Safety Act are obviously the duty to assess and review work-related risks faced by employees. Clearly, that is an area where occupational health can provide support in terms of particular employees and where those risks may arise from. Make and give effect to appropriate arrangements relating to preventative and protective measures. So there can where we're looking at things like reasonable adjustments and steps that can be taken from a health and safety perspective to minimise risk. You can see a clear synergy there with occupational health and how particular individuals might be affected by certain conditions and arrangements. Audit the adequacy of procedures. Record significant findings of risk assessments, and that's an obligation where you have 5 or more employees, and also to record appropriate arrangements that are in place. Again, an obligation with 5 or more employees. It's important to be mindful that as an employer, you're required by law to prevent physical and mental ill health in your workers, and that may occur as a result of your business activities. And that's a note from the Health and Safety Executive. So being mindful and using the resources available to you, such as occupational health specialists are able to provide, does help with compliance even of those sorts of basic health and safety rules that as employers you will be subject to. Clearly, we also have the Equality Act 2010. Interesting to read that in one of the manifestos of a particular party, there's talk of repealing this altogether. So interesting to see if they were to be successful on 4th of July, where that would leave equality law. The Act legally protects people from discrimination in the workplace and in wider society, and clearly occupational health can help identify and provide additional information relating to conditions that may amount to a disability under the Equality Act 2010. So where we're talking about disability, it's always helpful to go back to the definition within the Equality Act and consider that it's a physical or mental impairment which has a substantial and long-term adverse effect on the person's ability to carry out normal day-to-day activities. So ACAS guidance states that by law, all employers must make sure that they do not unfairly discriminate in any aspect of their work, that they take steps to prevent discrimination, that they do all that they reasonably can to protect people from discrimination by others, and that they look after the well-being of their employees, which is obviously the duty of care that they have towards their employees. The Equality Act also, beyond identifying conditions that may amount to a disability, occupational health should be used to comply with the duty to make reasonable adjustments for disabled employees. So where we're talking about reasonable adjustments, what are we talking about there? Well, we're talking about taking steps to avoid substantial disadvantages to disabled persons caused by a provision, criteria, or practice. So that can be a rule, a way of doing things, and a methodology that's used within the business that for some reason causes people with particular disability to be placed at a disadvantage. Take steps to avoid substantial disadvantage caused by a physical feature of an employer's premises that's, let's say a more visually obvious situation where access issues, for example, might be challenging for individuals with a disability. take steps to provide an auxiliary aid where the provision of such an aid prevents the disabled employee from being placed at a substantial disadvantage. And that could be, for example, a different type of chair, a different type of screen, a different type of desk. It could be ear protectors. It could be all kinds of things that influence the way that a disabled person may be able to work and may benefit and have any disadvantage taken away. The need to make reasonable adjustments and the role that medical evidence occupational health plays in this. Well, occupational health can provide expert evidence on reasonable adjustments and workplace accommodations. Reasonable adjustments could include removing physical barriers, as we've said. It could be short-term support that someone needs to get over a particular challenge that they have as a consequence of their disability. The challenge itself might not be long-term, even though the disability is. Could involve changes to a job role and could obviously involve the provision of additional equipment or supports. Clearly, it's always important to bear in mind that reasonable adjustments are, by their nature, adjustments that are reasonable for that employer to make. Clearly, sort of touching on what Ron mentioned earlier, certain adjustments that might be reasonable for a large multinational company to make are much less likely to be deemed to be reasonable for a very small business with a low turnover. Again, going back to some of what Ron has said, it's really important to ensure that medical evidence is kept up to date. Relying on old medical reports is risky and may strengthen or give rise to claims. Quite often, I find myself in a situation advising employers where they may have an individual who is on long-term sick or who has persistent challenges that may be due to an underlying condition, where they have had, whether it's a report from the GP, whether it's a properly commissioned occupational health report, but it's several months or even a year old. And the difficulty there is if you were to take action 6 months down the line, a tribunal, as Ron said, is very unlikely to have a great deal of sympathy with an employer that's relying on medical evidence that is that old in terms of making either steps to assist an employee or managing their absence or reviewing what their future absence, for example, could look like. So taking that kind of action off the back of out-of-date medical evidence is highly risky and could render, for example, a dismissal unfair or potentially discriminatory. So keeping that fresh and up-to-date medical evidence is important. Again, touching on something that Ron said earlier, the importance of keeping things moving forward can never be underestimated, in my view. There is a temptation amongst employers sometimes where an individual is signed off as unfit to work, that they're simply left to their own devices, left be, and the focus switches to the task at hand in terms of keeping the business running and who's doing the work that the employee should be doing, without actually thinking, well, can we actually be progressing the concerns and the issues with the employee in the meantime? And that's particularly relevant if the individual is benefiting from sort of enhanced sick pay, and costing money to the company, in essence, from that perspective. Leaving them in limbo is, in essence, quite unpalatable. And furthermore, in terms of resolving matters without going to tribunal, or resolving matters should they go to tribunal in a positive way, being proactive and seeking to assist the employee it's very unusual that would ever be criticised. So rather than leaving things up in the air whether an individual is signed off, occupational health reports can provide clarity as to whether individuals can attend meetings, participate in investigations, and what adjustments are needed in order to unblock situations, generally to the benefit of all involved. So I think an important thing I always note there is if someone is unfit to work, that means that they're unfit to come in and do their day-to-day job. It doesn't mean that they're unfit to participate in a meeting, particularly if some adjustments and support can be offered to them. From our perspective, that's what we were looking to cover off today. So thank you for listening. Do carry on putting any questions in. We will now take a bit of time to answer those that have been submitted. Ron, I think this is the one that's been submitted during the course of this session by James, and I think probably your best place to answer. So the question is: we find managers are frustrated by a lack of clear outcome from a referral report. As an ER team, we support managers ensuring they give a lot of background information, including how flexible we can be. The report comes back stating if these adjustments are put in place, this will support a return to work. The manager complies, but the employee does not return. We refer back and the OH report continues to support the employee not returning, even after all adjustments have been completed. Why is OH not more assertive in a clear decision to return?
Okay, thank you, James, for your question. Okay, so there's a few things I'd like to just kind of pull up from there. Obviously, I can't comment or speak on the quality of other providers' occupational health reports, so I'll kind of talk about it in general terms. I think when commissioning an occupational health company, what's really important is they understand your business, understand, about your roles, your policies and procedures and all of that. I think that's the first thing that must be understood, because then it means that the advice you're getting back will be kind of more kind of prudent into your area, your sector and things. I think you say there that the ER team help the manager fill out, so that's good, because I think quite often managers think they're giving a lot of information in a referral and they're simply not. So I think check that the referral is being completed properly. Ensure that the employee's consent is gained, because when you gain the employee's consent, you potentially may find other things that you want to add into the referral. So there's a joint approach there. We tell all employees that we see that whether they like the report or not, we will not change our medical opinion on their fitness, but we will change factual inaccuracies, and we are quite firm on that. So if I think someone is medically fit to work, but they disagree, we will say in the report, in our opinion, X is fit to return to work. However, they disagree. And then therefore, as the manager or the employers, you're like, okay, well, we know that you're medically fit, so why do you disagree? So that can then obviously open up a conversation when you meet with them once you've got the OH report. I think in our consultations, what we do and what is actually quite telling is we ask two questions at some point in the consultation. And the two questions we ask are, how important is it for you to get back to work? Give it a number between 1 to 10, where 10 is very important and 1 is not at all. So we ask them that question. That lets us understand kind of their mindset. And then we follow up with, how confident are you that you will be able to return to work? And we get them to give that number 1 to 10 again. And the reason we ask these questions is because if we're concerned about, yes, they're medically fit, but we feel that there's a motivational issue going on there, that two questions quite often will expose that motivation. And then we can start to have the conversation about adjustments and how we can change that view, perception, whatever it may be. In our reports, we also bullet point our recommendations, so they're easier for the line manager to kind of read, consider, and kind of tick off effectively. And also from our point of view, what we do is we clinically audit all our reports on a monthly basis, because the quality of the report and advice to Agile is really important, because we see the report as our product. I do know, because I've worked in other providers, that some other providers, they only audit once a year. So if they've got a clinician that's not particularly giving good advice, they only pick that up once every 12 months. Us, where we believe we audit regularly, so we would pick anything up much quicker. And we would also ask for our clients' feedback to ensure that the standard is maintained. So I think if you're finding that your OH advice is not really helpful, it's potentially time to look for another OH provider.
Thank you very much, Ron. I'm just conscious of time, and of the other questions that we've submitted, I think there is one particularly pertinent one that I think has a lot of practical relevance to a lot of people. And the question is, what should the employer do if the GP fit notes and the occupational health report are conflicting? So, for example, if a GP says that the individual is not fit for work, but the occupational health report says that the individual potentially is either fit or fit to return with certain adjustments, what would an employer do in those circumstances?
Okay, so I think it's important to note that the GP will always advocate for their patient. So they 9 times out of 10, they will always sign them off. And I attended a meeting with the Department of Work and Pensions where their lead doctor was also a GP, and they pretty much kind of attested to that. So I think when you see the GP from that point of view, then you will get conflicting advice. So the OH doctor, nurse, physio, whoever it is that's seeing the individual, they're the specialist in this arena. So if you had a cardiac problem and you went to your GP and your GP said one thing, but then you went to a cardiologist and they said this is what you need, whose advice you can take, you're going to listen to the specialist. So I would always encourage that they listen to the OH advice. You're perfectly within your rights to take the OH advice over the GP's advice, because the OH professional will have considered the fit note, and if you've submitted the fit note with a referral and the GP signed them off until the end of July, we will say, no, actually they're fit to return to work from, 27th of June. And you're perfectly within your right to kind of pursue that and go down that road. So remember, OH is the specialist within that arena. The GP is the generalist who will always advocate for their patients. That's where we're impartial, so we will give our honest opinion.
Thank you, Ron. That's really helpful. We'll go through the other questions. I'm conscious we might slip over anticipated time in dealing with them, but I think it's important that we answer the questions that we have been given. So the next question we have is, when a large proportion of HR magazines have many articles stating how well companies are dealing with employee well-being, why has there been a 35% increase in employee absence? Giving an example from the 2019 CIPD Simply Health survey of 7.8 days per person in. There is now 7.8 days per person in 22-23 compared to 2019. So there's been a 35% increase in absence.
Okay. I would say, first of all, 2019 to now, there's been quite a lot of things happened, mainly a global pandemic, which I'm sure is contributing to a lot of this. Putting the global pandemic aside, so employee well-being. So this is a really interesting topic to me, and it's something that I've kind of been thinking about for a very long time. And then there was an article in the Guardian in January 24, and I thought, someone is on the same wavelength. This is brilliant. So this was an article by Andre Spicer in the Guardian 2024. January, and it was based on a study done by Oxford University Professor William Fleming, who examined the impact of a wide range of workplace well-being initiatives. And it was really interesting findings. And it went on to say that in 2021, 61.2 billion was spent on wellness interventions worldwide. And in 2026, it's going to be 94 billion worldwide. And effectively, he didn't think they worked. And there was lots of evidence to demonstrate this. They had done studies and so on and so forth. So they were saying that sinking money into mindfulness apps and resilience training ignores the real problem. And this is controversial, you know, but if you think about it and you read the article, it actually kind of makes quite a lot of sense. Stop smoking initiatives, you know, they very rarely work unless the person actually wants to stop smoking. Your employer handing you a stop smoking leaflet isn't going to make you stop smoking. Offering healthy eating plans, advice on food, and introduction cycle to work plans. I mean, how many people in your organizations have took up the cycle to work plan? You know, if you start to think about in reality about what you're offering and what is actually making a difference, this starts to kind of make a lot of sense. Giving employees to apps to track their movement and track their sleep. You know, if someone is overweight, they know they're overweight. They don't need to be told about it by an app. So it takes up money, time, and has little or no impact on employees' well-being. So that was interesting. They suggest what a company needs to do is should focus on employee well-being and to focus on a more structural aspect of their work. So these include improving pay, improving secure contracts, giving employees flexibility, giving more control over their work schedule, and providing opportunities for upskilling and mentoring. And the upskilling and mentoring was one of the most important things by for employees, to see that they're progressing in their career, to see that they've got support from a mentor, you know, because a line manager is often equally quite busy. So it's quite an interesting article, and I'm happy to share it with you and share the research with you. It's also on our LinkedIn page should you want to think it. But I suppose one of the questions it proposes is, have you ever taken a job based on the company that you're applying for having a cycle to work scheme or a wellness app? You know, the answer to that's probably no. What's made you take a job is pay, annual leave entitlement, flexibility around working locations, childcare facilities close by or childcare facilities on the premises, private health insurance. That's the things that employees value, and it really helps with their kind of well-being, I would suggest. So I would suggest, you know, looking at your health and well-being plan and your strategy and thinking, what are we trying to achieve here? You know, getting a nurse to come on site once a year to do some blood pressures, probably not going to do anything. Because their blood pressure is probably going to be high because they're at work.
Yes. Scare a lot of people.
It's about thinking about what you're doing and what you're trying to achieve, rather than just going, oh, we'll do this, we'll do that, we'll do that. Think about your population. What is it they need? Survey them. Ask them what they would like.
Yeah. Brilliant. Thank you. Next question, fairly similar. It appears increasing numbers of employees have mental health challenges when compared to 30 years ago. In brackets, although I appreciate mental health at that time was virtually unknown, discussed. Why might that be the case? What can you suggest to employers to support mental health resilience for their employees?
Okay. So quite right in the questioner is 30 years ago, if you looked at mental health to look at it now, we've kind of demystified it. We've tried to take away the stigma. People are more forthcoming with it, not suffering in silence, which is all the things we want. We want it out there. We want people to come forward. We want people to get the support. 30 years ago, so we're talking what, early 90s, that certainly wasn't the case. You know, certainly wasn't the case at all. I would suggest that I would suggest that with regards to modern work and the modern environment, if we look at it, like for instance, emails 30 years ago were in their infancy. There would have been very few employers kind of having them, you know, late 80s, early 90s. They certainly wouldn't have been smartphones with your work emails on your phone, which is pinging 24/7, 365 days a year. You know, 30 years ago, when you left work, you probably left work and switched off and had downtime, had family time. So I think that is a massive contributing factor to people's workplace stress. I think your policies and procedures need to be in place where it says to managers, if you want to send out emails at 9 o'clock at night, time them so they go out in the morning, because as soon as that email pings on that person's phone, even though the manager doesn't expect a response, that person is automatically thinking about that email and how they're going to respond and what they've got to do at work tomorrow. So I think that's a big piece that employers can really look at around their policies. Things like when people go on annual leave, say to them, can you take your work emails off your phone, please? So you can actually go on holiday, you can actually detach, you can actually recharge. I think 30 years ago, there was probably more part-time working for I think we picked up on this point in the very beginning, women in work. A lot of women were probably, potentially at home. There's much more people in the workplace now. So not only have they got all the responsibilities that they have at home, but they've now got their work on top of that. We've been sold this idea that you can have the job, you can have the family, you can have the holidays, you can have the house, you can have the car, you can have it all, but something's going to give. And what does that tend to be? Our mental health. That's the thing it seems to suffer. So I think the world is a lot busier. I think we're constantly in contact communication with people. We don't really turn that off. So whether workplaces can instill policies or procedures around that is interesting. I think it's one of the best things on one of the organizations I worked in that was really quite good kind of for well-being and mental health was every December, in addition to your annual leave, they gave you a Christmas shopping day, which sounds a bit odd, sounds why, but can I tell you, as a working parent with 4 children, me being able to go out on a working day, do my Christmas shopping when the kids are at school, get home, get the presents wrapped, get them hid for Santa to deliver them on Christmas Eve was such a massive kind of stress reliever, because I didn't spend the whole December running around thinking, how am I going to get this done and all the rest of it. So sometimes simple things like that, extra days annual leave to do Christmas shopping. And another thing an employer did was, and as well as your annual leave, you got your birthday off, which was always quite nice because, especially if your birthday lands on a weekday when the kids are at school, you've got a whole day all to yourself, So, I mean, no one's saying that you've got to make these big grandiose plans. In some sectors, you can't do that sort of thing. But it's about just thinking, how do we reduce stress in our employees? And I'd say the number one thing is when they go on holiday, tell them to take their work emails off their phone.
Yeah, I think that's very good advice. And actually, I think there's a couple of the parties in their manifestos are actually talking about introducing regulation around those sorts of things, which yeah, I mean, in some countries I think already exists. I think in Scandinavia and places like that, but it seems entirely sensible to me. We've had one more question submitted online, but I'm just finishing the ones that we've got in advance first. We've got one more here. So what is your opinion on organisations carrying out onboarding health questionnaires themselves? What is the benefit of an occupational health provider like Agile OH facilitating this on behalf of an employer?
Okay. So the guidance in 2023 from the Information Commissioner's Office states it is good practice for questionnaires to be designed by health professionals. This also means that they should be interpreted by those qualified to draw meaningful conclusions, and for the information to be supplied by the employee directly to the health professional. So cutting out the middleman, i.e. the employer. Also, in addition, under UK GDPR Article 6 and Article 9, health information is a special category data. Essentially, employers may process employees' data, but not health data. All medical information for employees should only be viewed by medical professionals. So therefore, I think that all pre-employment and such not should be done by your OH provider. It's because potentially you could get yourself in sticky situation, given that that's the GDPR and the Information Commissioner's Office's statements on it.
Yeah.
I don't know if you want to add anything to that.
No, I think that's good advice, to be honest. Yes, I think sometimes there is a tendency amongst employers to take more information than they should, but also not be conscious of the type of data they're taking and particularly the sensitivity with which it's regarded. So I think that's very sensible advice. Final question then from Yvonne. So she has asked, is it okay if you're unable to contact the staff member to email them advising you are referring to occupational health? And that's possibly more a question for myself and Veronica to answer. I would say yes. I think at the end of the day, unless there's a particular wide concern about contacting an individual whilst they are off work, then it's important to be able to contact them, be able to progress matters. Going back to what we were saying earlier, leaving things in limbo rarely benefits anyone. So I would say if the only means you have of contacting someone is an email, then yes, do that. Perhaps with relevant caveats around that, saying take your time to come back to us. Let us know if there's another way you'd like to contact us in the meantime, and those sorts of things. But unless it's been already made very clear that you shouldn't be contacting someone at all, then a request of this nature that relates to them and their health and looking to bring them back into work, I think is more than appropriate. Do you want to add anything to that, Veronica, at all?
Yeah, what I'd also say is in terms of contractual obligations, some contracts of employment actually provide for that and or policies and procedures. So just refamiliarise yourself contractually or procedurally what parameters that provides for. And going back to the sentiments throughout the webinar is not doing anything really is not a good way forward, because you always want to look to progress the case unless there's some very clear reason why you wouldn't be in contact with that member of staff.
Can I just quickly add on there to say that it's fine provided you use their personal email address, because it's quite likely that an employee won't be using or looking at their work emails.
Very good point, Joe. Yes, you're quite right in doing that, in raising that point. Thank you very much everyone for attending, and thank you to Ron and Joe for joining us today. I think it's been a really good session. The recording will be available as well. We'll circulate that. If there's anything else off the back of this that you'd like to ask or get in touch with us, then please do. Our contact details have been on the slide that's showing. But thank you very much, and have a great afternoon, everyone.